Hey everybody, Dr. Leo Crowell, it's a Healthy Feet Podiatry. Got another ingrown nail, not like any of the other ones. This one's totally different. She's never had an ingrown nail before, and she never had a toenail on this toe before. It grew out of nowhere, so it's like an alien. I'm just making this up as we go along. The patient's looking at me like, are you insane or what? We try to think of a crazy spin on this, but there is no crazy spin. And this is no different than any of the other ones, but we'll see if this is more exciting. Maybe there'll be something special hiding under the nail, but she's been having a lot of pain with this toe. So let's go ahead and wrap this up. We already numbed her, and the patient's a screamer, according to the patient, correct? She's laughing right now. She did yell a few things at me when I numbed her up, but not any different than anyone else. And this is the tourniquet that we're putting on now. She's got a look on her face like, what is going on my toe? So, this is a tourniquet for your toe, okay? We wrap this real tight, and this is so it doesn't bleed. And you watched the other video, right? So you saw that we had the thing wrapped on the toe. Do you remember seeing that? Okay. So we're gonna open this up so I can see what's going on here. So, okay. On a serious note, does that hurt? Okay, bending the toe? Okay. So she doesn't like it when I bend the toe. That hurts her. You can tell me if it hurts or anything like that, or raise your thumb. The two sides of the toe is what's really been bothering her. This started to get red here. She's had this as an ongoing problem. And if you look real close, you can see that it's actually pretty red and a little inflamed there. I don't know, were you digging at the base of the toe or did it just get, okay, it got black and blue there. So we're gonna put her on antibiotics. She's gonna take Augmentin, which is a broad spectrum antibiotic, kills a lot of different types of bacteria, twice a day, 10 days. We'll make sure that redness goes away because she has been trying to cut this out herself, which we know does not work. So let's get the sides of this out. We're gonna free this up. I'm gonna try to be real gentle here. Just raise your hand or let me know if it starts to hurt. Does it hurt this joint when I bend the toe, or what is it? It's annoying when it bends down.
No, it's the arch.
Is that what it is? Okay, so I'm just gonna push on it and see. Any pain? Okay. How about right here? Any pain?
No.
Okay. All right. And I'm gonna move it this way. So we're gonna go gently here. Free both sides up. No pain there, right?
No.
So there's still some bleeding, and that's leftover blood from, they call it venous congestion. So even though we push the blood out of there, there's still a little bit of leftover blood in that area from the veins that are trying to bring the blood away from there. But that should dry up pretty quickly. Is the talking bothering you at all?
No.
No? Okay. All right, we're gonna get the side of this out. This is the worst side of it. And you can see, do you see that light right there, how it lightens up? Sometimes when we go to do this, we try not to do it, the nail will lift up. And there's not much we can do about that. That's just the nature of this when we take the nail out. So part of it too, that nail was probably already coming loose from infection. So there may be some fluid collected under there too. And I think that's part of the reason we see that, that it was already starting to get inflamed and infected and there's fluid accumulating. So I'm doing both sides here and you can see me as I clip underneath this. That other side did not lift up like this side. So we'll take this side out first. This seems to be the better of the two sides. Let's see here. You know what? Let's see if we can get this. Yeah, there it is right there. This side is not that bad actually. Do you see this is a very small piece here? And I'm gonna show the patient too. If you look at the end, this leading edge right here, still looks like it's digging in the skin, so I'm gonna have to take a little bit more, but that's a pretty good chunk right there. This came out of the better side, okay?
You doing okay?
Doing good? You want me to lay your back down? No? Okay. This leading edge right there is what I'm talking about, so I'm gonna clip a little bit more of that. The key part is right back here at the epinicium area. That is what we want to make sure it's free. This part right here is just leftover. See if I can get that off of there. Okay. And that's just so it doesn't dig in as it heals, because what happens is you tend to swell up when the nail is removed. And when you swell, it'll swell over the top of the nail. So, how you doing up there? Good.
Real good.
Okay. Now this is the side that's growing in. So we're going to go under the eponychium. Everyone's favorite word. Eponychium is, by the way, is underneath it. You okay? Pain? Bending it? Okay. I was going to say, don't watch or it hurts more. And I'm going to twist and turn here. Again, not as large as we would think. It's about the size of the hemostat. Do you want to see the piece? Get that satisfying feeling when you see that? Not really.
I think that's just us.
That's us. That gets it. You okay?
Yeah.
Is it hurting when I move it or no?
Ankle hurts.
Yep. Go ahead and go ahead and move your foot around. Do you want to move it around?
Go ahead.
Okay. Better?
Yes.
Okay. And I'm gonna just clean this little piece off here. And that's where the tip of that nail was digging in. And then over on this side here, this looks good. So this is where the nail, you can see how it's lifted a little bit. This may actually reattach. That's fluid under the nail. But it'll dry out too, because now all that fluid can head this way and this way if it needed to. But you can see it's mainly on this side. It will dry up, and as this nail pushes out, if it pushes out, it'll be reattached. If not, a new nail is just going to push this piece out anyway. It should not be an issue. And she's on going to be on antibiotics anyway. Okay, let's get rid of the nail matrix, the area where the nail grows from. So we're putting the chemical in here. You okay? No pain, right?
Yes.
Okay. Is it uncomfortable the way I have your toe? That
Oh,
holding
I'm
your toe?
good now, yeah.
Good, cool. Yeah, this is just the boring part where we put the chemical here so it won't go back. And we do 3 sticks, and we're going to kind of speed this up a little bit for her so she doesn't have to think about your toe, right? You don't want to think about that.
Yeah, okay.
All right. And the other toe is doing the same thing, so we're going to do the same procedure on the other toe when she comes back in a couple of weeks, as long as everything looks good. And we'll make sure that you take those antibiotics. So there's one side of it. You can see that when I burn the nail matrix here under the eponychium, see how it turns white? That's how we know that we did our job. And the job is done. So that side is done. Now we're gonna kill this side permanently. How are you doing over there? Kind of cool, huh?
Yeah.
You'll be the expert at doing this next time. We'll have you do it. If you want to do it, I'll let you jump in. Many times we do that. Just random people come in the room and start doing the procedure that have watched the videos online.
Gotta practice
Maybe
somewhere.
we should do that. That would be kind of fun. How well can you do a nail surgery after watching YouTube multiple times?
They might pass out.
Yep, right.
Maybe, maybe not. So I'm making it sound like it's that easy, but after a while it does get easier. A lot of this is, you have to know the anatomy, you have to know the physiology of how things heal, but the reality of it is it's a procedure and you just have to learn how to do the procedure. So I think that we could teach someone to do it. They just might not know the medical background and the physiology stuff that goes along with it. This right here, I don't like the way that looks that much because it's kind of curved, so I'm going to make this cosmetically a little better. It's still going to be a little curved, but the main point of this side with taking more of the piece of nail here was just so it doesn't swell over the top of that nail. So we're going to just make it look a little prettier too. And that way it doesn't look too distorted, but you can see right here, it's kind of it has a curvature to it. But the key is this gap right here. See the gap right there? That's key because that's, it won't swell over it. So it's not going to be a problem afterwards. And that's a problem for a lot of people with walking with this, anything out of there, with this procedure is that they get swelling of the toe after the procedure, and they think they have another ingrown nail, and it's not an ingrown nail. It's the leading edge of the nail touching the skin and irritating it from swelling. Let me get a new thing here. I'm putting vinegar on here to neutralize it. vinegar and water, but we're low on vinegar, Alexia.
We will refill it.
So we're trying to get as much out of this as we can. And that's it, now it's nice and clean. All right, now we're gonna put antibiotic ointment in. Actually, you know what? Let me get this off first. So, let's get this. Oh, is that hurting your toe?
My feet are crazy sensitive.
Okay, no problem. Let's see. Let me use this.
This one?
I'll use this. This is easier. So we're trying to pull this thing off. Antibiotic ointment in the toe. So you can see the toe's real white, and that's from the anesthetic in there and the epinephrine that's in there, so it doesn't bleed. That a lot of people are afraid to use epinephrine in the toe. As long as someone has good circulation, you don't have to worry about it. And we wouldn't do the procedure if they didn't have enough circulation. So that's another thing too. If I can't feel their pulses, pulse here and a pulse here, I'm not doing the procedure on the person. So we don't have to worry about epinephrine and cutting off the circulation in the toe temporarily for the procedure. The dryer field, in my opinion, is the way to go because the chemical will take and they will not get regrowth and they won't have to come back here. So that's it. This was not the most exciting procedure ever. Didn't really impress myself this time with this procedure because it's kind of the same thing, but
It
nothing
impressed me.
hiding under the nail. Oh, good. At least somebody was impressed. But maybe you watching this video are impressed by it. And that's it. She's gonna come in 2 weeks. We're gonna do the other toe. If you wanna see the other toe, this is what her other toe looks like right here. She hates it when I grab her foot, but this is what it looks like. It's not as puffy. This side's puffy, this side's not as bad, but both sides are gonna have to come out. And that's it. Another great ingrown nail surgery. If you like what you see, subscribe to the channel, and we'll see you for the next video. Thanks.